Hello folks, welcome back. This is Kweku. I'm a pharmacist. This channel is dedicated to healthcare information as well as pharmacy stuff. So feel free to hit the subscribe button if this is something that you find interesting or useful. This video is a review of the medication Glimepiride, which is marketed under the brand name Amaryl. We will take a brief look at how the medication works, a brief description first and then how it works. We will look at some common dosages, some side effects, some precautions, and some best practices as well. Before we delve in, just wanted to mention that this video is for informational purposes only, and please use it as just that and not as a substitute for medical advice from your doctor. So Glimepiride is an anti-diabetic medication. It belongs to a class called sulfonylureas. It works by stimulating the pancreas to produce more insulin. As such, it is only for the treatment of diabetes in type 2 patients only. That's because you need your pancreas to actually be able to produce insulin to be able to use this medication. So for type 1 people who may not have their pancreas functioning enough to produce insulin, this is not a good choice of medication for them. It's actually not even approved for people with type 1 diabetes. Now, some common doses. Dosing usually starts at 1 or 2 milligrams once daily with breakfast or with the first main meal of the day. The dose may be adjusted or titrated up every 1 to 2 weeks, depending on the need or depending on the response to the medication, up to a maximum of 8 milligrams daily. However, the typical dose range is usually between 1 and 4 milligrams. Hardly do you see anybody on 8 milligrams. When it comes to side effects, the most common one is hypoglycemia or low blood sugar, occurring in about 4% to 19.7% of the population. And that's a very significant number. If you talk about 19.7% of the people, that's about 1 in every 5 people is at risk of developing hypoglycemia at some point in time whilst on Glimepiride. So that's definitely something to be wary of. Nausea has been reported in about 5% of the people, dizziness, headache. And another relatively undesirable one, which is weight gain, has also been noted with Glimepiride. Obviously, this is not an exhaustive list, but these are some of the more common ones that we tend to see on a regular basis. Another less common but potentially serious side effect is the development of Stevens-Johnson syndrome. Stevens-Johnson syndrome is typically manifested in the form of a rash, and it can be fatal, so it definitely needs to be taken seriously if there's a development of a rash anytime anybody takes Glimepiride. Now, some best practices. First of all, do not drink alcohol while you take this medication. That's because alcohol significantly increases the risk of developing hypoglycemia or low blood sugar, so definitely not a good combo if you are taking Glimepiride. Also, it would be a good idea to know the symptoms of low blood sugar and also how to manage them. Just know the symptoms, sweating, shakiness, and a few others. It will be good that even generally as a diabetic to know those things and know how to respond to them. And also maybe a good idea to carry a quick source of sugar with you. Usually it's recommended to have some glucose tablets or some hard candy with you just in case your sugar level dips too low, so you can immediately bring it up. If possible, also, while taking this medication, minimize your exposure to the sun. Glimepiride causes what they call photosensitivity, where your body actually reacts to sunshine. If at all you have to be outside, which obviously you can never stay out of the sun forever, just wear some protective clothing and use sunscreen to give yourself some protection. Also, do not take or double the dose of Glimepiride for any reason. Sometimes when people forget their medications, they tend to double up. This is not one of the medications, and for that matter, most medications you really don't want to be doing that. Just take it at the earliest time when you remember, or if you're close to your next dose, just skip this one and take your next dose at the appropriate time. Also, some things to be cautious about, or some things you need to let your doctor know if you are being prescribed Glimepiride. Number one is that if you have liver or kidney disease, you should definitely be cautious and let your doctor know. This is because such people have an increased risk of development of hypoglycemia or low blood sugar. Older people should also be a little bit more cautious. Actually, Glimepiride is generally not recommended in older patients due to the risk of development of prolonged periods of hypoglycemia, which sometimes can be life-threatening. It makes them delirious, confusion, So generally speaking, if an alternative can be found to glimepiride, that is what is typically used in older patients. I already talked about the rash Stevens-Johnson syndrome. Anytime you take glimepiride, you see any kind of rash. It may or may not be anything serious, but I would recommend that you err on the side of caution and let your doctor know so that Stevens-Johnson syndrome can be ruled out, because that can be fatal. Glimepiride is also not recommended during pregnancy, as fetal risk cannot be ruled out. Also, if there is a history of allergic reactions to other sulfonamides or sulfur drugs, a typical example, the most common example I can think of is Bactrim or sulfamethoxazole trimethoprim. This is because of the similarity in structure of glimepiride to some of these medications. So if you're already allergic to one of them, chances are that it may carry over to glimepiride. So if you already have a sulfur allergy, definitely let your doctor or your pharmacist know, and mostly they would prescribe something else if that is the case. So there you go, a very high level overview of glimepiride or Amaryl. As in any other medication, do well to follow closely your doctor's specific instructions for you, as different individuals may receive different instructions based on their clinical history. Thank you for staying through. If this video helped you, please give me a thumbs up and consider subscribing to this channel if you have not already done so. Thank you so much, and I'll see you on the next one.